Good evening and welcome back to the channel. Tonight we have a major development in global trade policy that could reshape the pharmaceutical industry, impact drug prices, and even influence international relations. The White House has clarified that the upcoming U.S. pharmaceutical tariffs, announced by President Donald Trump, will not apply to countries that already have trade agreements with the United States. This comes after confusion across global markets following Trump's announcement of a massive 100% tariff on certain imported pharmaceutical products starting October 1st. So what exactly does this mean? Who will be affected? And why is Washington using tariffs as a strategy to reshape global manufacturing? Let's break it all down. Earlier this week, President Donald Trump revealed a bold new economic policy targeting the pharmaceutical sector. The administration plans to impose a 100% tariff on what it calls branded or patented foreign-made pharmaceutical products. In simple terms, if a drug is made overseas and still protected by patent, bringing it into the United States could suddenly become twice as expensive. But there's a catch. According to the White House, companies can avoid these tariffs if they build manufacturing facilities inside the United States. This is not just a tax, it's pressure. The goal is clear: bring drug manufacturing back to America. Trump has repeatedly argued that the U.S. depends too heavily on foreign pharmaceutical production, especially after supply chain disruptions during recent global crises. The administration believes domestic production equals national security. However, markets reacted immediately and nervously. Pharmaceutical stocks moved, trade partners raised questions, and global allies demanded clarification. Now, according to a White House official speaking to Reuters, countries that already have trade agreements with the United States will not face the 100% tariff. Instead, those countries will keep the previously agreed 15% tariff rate under bilateral deals. That includes major partners such as Japan and the European Union. In other words, the policy is not universal. It targets countries without trade protections, while allies remain largely shielded. This changes the entire interpretation of the announcement. Instead of a global pharmaceutical trade war, it may become a selective economic pressure campaign. So why is Washington pushing this so aggressively? There are three main goals behind the tariff strategy. First, manufacturing relocation. The United States wants pharmaceutical companies to physically produce drugs inside American borders. For decades, production shifted overseas due to cheaper labor and regulatory costs. Now the government wants it back. Second, economic leverage. Tariffs generate revenue, but more importantly, they influence corporate decisions. If producing abroad becomes expensive, companies invest locally. And third, national security. Officials have repeatedly warned that relying on foreign countries for critical medicine could become dangerous during emergencies, pandemics, or geopolitical conflicts. This policy aims to eliminate that vulnerability. In simple terms, pay tariffs or build factories in America. Not all countries will feel the same impact. Allied economies with negotiated trade deals may continue operating with minimal disruption. But manufacturers located in countries without strong trade agreements could face severe consequences. Pharmaceutical exporters that rely heavily on the U.S. market may suddenly lose price competitiveness overnight. And remember, the United States is the largest drug market in the world. Losing access or becoming expensive inside it can dramatically affect company profits. This creates a powerful incentive: relocate production to America or risk losing market share. Some analysts are already predicting a wave of factory announcements within months. Now let's talk about what matters most to everyday people: cost. Will drug prices go up? Short term, possibly. If supply shifts suddenly, shortages or higher import costs can affect consumers. But the administration argues that long-term domestic production will stabilize prices and reduce dependency on foreign supply chains. Critics disagree. They warn manufacturing inside the U.S. is significantly more expensive, and companies may pass those costs to patients. So the real effect may depend on how fast companies adapt. If factories are built quickly, prices stabilize. If not, temporary increases could happen. International response has been cautious but attentive. Because the White House confirmed exemptions for trade partners, tensions may remain contained, at least for now. However, countries without agreements could push back diplomatically or economically. Trade policy often works like a domino effect. One tariff leads to negotiation. Negotiation leads to concessions or retaliation. Markets will be watching carefully over the next few weeks leading up to October 1st, the planned implementation date. So here's the big picture. The U.S. is not just taxing pharmaceuticals, it's redesigning the global supply chain. This policy is a strategic move aimed at bringing manufacturing back home, strengthening domestic industry, and reducing foreign dependence. But by exempting allied nations, Washington is trying to apply pressure without triggering a full-scale trade conflict. Whether it works will depend on one thing. Do pharmaceutical companies move production to America? Or do global trade tensions escalate? The answer could shape the future of medicine, pricing, and international economic relations for years to come. We'll continue monitoring updates as the October deadline approaches. If you found this breakdown helpful, make sure to subscribe and stay informed with clear, factual global news coverage. Thanks for watching, and we'll see you in the next report.